Milwaukee's VA Medical Center received nearly 3,000 doses of the COVID-19 vaccine. They're vaccinating frontline healthcare workers and staff first, then veterans living in their long-term care facility. So we're talking about the VA's COVID immunization plans with Dr. Jane Kim, the Chief Consultant for Preventative Medicine at the Department of Veterans Affairs. And we appreciate you being with us today. And I know you know how important the VA is here in Wisconsin. We have 3 VA medical centers, Milwaukee, Madison, and Tomah. Could you go ahead and tell us the progress you've made so far in terms of vaccinating those healthcare workers?
Yeah, thank you for having me. So this has been a great week in VA. We started vaccinating on Monday with our first supply of vaccine, and the very first person to receive vaccine in our VA healthcare system was a World War II female veteran in Massachusetts, and that was just a thrilling moment. So since that first vaccine was given, we have continued to roll out vaccination to our healthcare workers who are on the front lines, as well as our veterans who are living in our long-term care facilities, trying to ensure that those who are at highest risk are offered the vaccine first.
And why do you want veterans so high on the priority list?
So veterans who are at high risk for COVID are really the ones who we've seen throughout the pandemic have a risk for severe disease and even being in the hospital and from COVID. So veterans who fall in those categories are really those ones who are older, who have the medical conditions that put them at high risk. I think there are other veterans who will be offered vaccine as we have more supply. So younger veterans and those who are healthier should be receiving vaccine sometime next year.
And last question for you. I know that you already received the vaccine and that you're feeling fine, which is some good news. But we're also hearing that some facilities are getting extra doses they didn't realize they'd have of the vaccine. So what is your plan at the VA?
Yeah, so this week across the country, people who were giving the vaccine found that as they were drawing up doses that they found that they had 1 or even 2 extra doses in each vial. So the FDA said yesterday, if that happens and you find an extra dose or 2, that it's okay to give that. We decided in VA to go ahead and let our staff administer those vaccines. We will make sure to track that so that when it comes time for the second dose of vaccines, we make sure that we have enough and that we record that in our system. So we are getting some extra, I guess.
All right, Dr. Kim, thank you for your time. We appreciate it. Good luck.
Thank you so much.
Coming up, how Giannis is good for the economy.